to go back to.
Yeah, I had a question. Jeez, I wonder if I can remember what it was. But it was about the jeez, now I can't remember what it was. I'm gonna have to watch her video again and remember. Okay. As far as that medication, where do we sign up for it?
Yeah, so as soon as we have money to do it, we put it out. The way the study is designed, and really for safety reasons, is we enroll a little group, like 5 patients that are in that young adult range, have them on for a few months to make sure there weren't any surprises or things that we weren't expecting, and then we keep moving younger, eventually getting down to kids, as young as 2. I think that was our lower limit, but going down in batches. So anyone that, knowing that people are interested is really helpful. I'll probably post something, if we have a letter saying, anyone willing to sign or whatnot. But yes, we'll keep you as updated as we can, and hopefully in the next year. Yes?
So the idea then is that the optimum would address this MC4?
Yeah, so the idea is that it kind of could address everything. So we also would follow thyroid hormone and LH, FSH, pubertal hormones, and other, all the other things. I don't know that it'll make people not need any of those hormone medications, but maybe it would make it a little easier to control, or we see doses going down. But yeah, the idea is for weight, that it gets into the brain and it makes those MC4 receptors work a little bit better. And one of the things we know about the MC4 receptor is it matters. It's not an on-off one. So it's one where if it's working perfectly, you get one thing. If it works a little less, you have a little more weight gain. If it works a little less, you have a little more weight gain. If you don't have any working at all, you have a lot more weight gain. So it is a sliding scale as opposed to you have it or you don't. So we're hoping if we could slide people up the scale a little bit, we might be able to help with the weight gain. Theophylline also, it's a lot like caffeine, so that's what its side effects are most similar to. So it also just in anybody tends to rev up a little bit. Yeah, so it's not crazy to think, but we're hoping it'll be particularly helpful for our patients.
Are you thinking that there's exclusionary factors, like I noticed on some of the other brands, like having seizures or taking specific medications already would take you off the...
Yeah, so especially in the study, there always are exclusions. So the idea is to get the group of patients who are most likely to benefit and also least likely to have side effects. So seizure disorders without, not hypocalcemic seizures, but general seizure disorders will probably be excluded in the first run because it can lower the seizure threshold, and we don't want to cause problems before we know if it will help. Once we know, if it gets to the end where we say, gosh, this really worked, then it becomes a very different discussion. If we could say to you, I know this might help with weight, it also may increase seizures, that's very different than saying, I don't know if this will help, and I do know it might cause a problem. So it will be a little stricter at the beginning. Yeah.
Yeah, we're looking at A1C and fasting glucose. Are you seeing any correlation with type 1? I know we talked about type 2.
No, there's no known correlation with autoimmune diseases and PHP. So some people will get told that they have Hashimoto's or thyroid disease, but usually that's not really what it is. It's that they have resistance to the thyroid stimulating hormone, and yeah, we don't know of any autoimmune disease correlation.
Two questions, actually. So the when you test the hormones, is it possible that the results that come back are, we'll say one thing, okay, so my estrogen testosterone comes back and it's normal, it's fine, but my body's not.
I feel like cycles aren't normal.
Or like the libido, or it's not normal.
Yeah. So hormone testing is always sort of like you're taking a snapshot of one little moment. And we have to look at them, we have to look at our ranges compared to sort of a big group of population. And one of the struggles we always have is, well, we know what's sort of like overall normal, but we don't necessarily know what's exactly normal for you. So it's true, like someone can have what's considered a normal estrogen level, but it's really lower than it probably should be. Same with